So I know you've been hearing about the federal government shutdown, and you might be wondering, how does this affect your Medicare or your Social Security benefits? Will payments stop? Will open enrollment still happen? And what about the cost of living increase for next year? A government shutdown happens when Congress doesn't pass the annual spending bills that fund day-to-day operations for certain federal agencies. Some departments temporarily close or reduce staff until new funding is approved, but not every program stops. Medicare and Social Security are funded through what's called mandatory spending. So that means their funding continues automatically by law, no matter what happens with the shutdown. Your Medicare and Social Security benefits do not stop. Your Medicare coverage stays active. Claims and payments between Medicare and insurance carriers continue. The annual open enrollment period from October 15th through December 7th is still happening on schedule. You might notice longer hold times when calling Medicare or Social Security. Go figure. Minor delays with paperwork, appeals, or updates. Some non-essential administration staff may be temporarily furloughed, but none of this affects your benefits or your ability to make changes. Your coverage remains in place. Now, let's talk about Social Security. Just like Medicare, Social Security is protected under permanent law. It doesn't rely on the yearly funding bills that cause shutdowns. So monthly payments continue on time, including retirement, disability, and SSI. There's no action you need to take. There's possible slowdowns. Fewer staff may be available at field offices. New applications and appeals could take longer. Certain verification mailings may be delayed. And yes, the cost of living adjustment COLA announcement for 2026 is temporarily delayed. That's because the Bureau of Labor Statistics, the agency that calculates inflation, hasn't been able to release the September data yet. Once that data is released, the COLA will be announced. So it's not canceled, just postponed a little, because the Part B premium on Medicare has been announced for next year. It will be $205.60. So usually when they raise that, because this year it's been $185 per month for your Part B premium. And it's, again, going up to $205.60 for 2026. So usually when that goes up, they also raise the COLA. You might have seen also headlines or heard talk of the government shutdown is over healthcare. That phrase is very confusing, so let's unpack it. When the news says healthcare, they're not talking about Medicare directly. They're talking about the under 65 health insurance world, things like the Affordable Care Act, marketplace subsidies, Medicaid funding, and public health programs that need yearly budget renewals. Those are the areas Congress is debating, not the Medicare or Social Security systems. So while the news headlines might sound alarming, and they do, and they will, to get your attention, here's the reality. The shutdown debate about health care applies to marketplace insurance, not to the Medicare benefits that you already have. Medicare's funding is automatic and separate from those negotiations. If you're on Medicare or Social Security, here's what you need to focus on right now. Stay organized, keep your Medicare card, your plan details, and Social Security paperwork always together in one place. Review your plan early. Annual enrollment period is happening now. It's really about to start officially October 15th, runs through December 7th. And especially this year, it's best to not wait until the last week in case you need assistance on anything as far as getting your Social Security set up or your Medicare set up. Those are the pieces that could be slowed down just for processing times. Get information from official sources, Medicare.gov, SSA.gov. These sites do remain up and running through the shutdown. Also, avoid misinformation. There's a lot of confusion online, but your benefits are continuing and secure. So let's recap what remains completely unaffected. Medicare coverage is active. Social Security payments are being sent on time. Medicare annual enrollment period is proceeding as scheduled. Insurance carriers and plan changes are not affected by the government shutdown. They are affected by a whole different situation. You can watch other videos that I've put out that talk about that. It's completely understandable to feel uneasy when you hear government shutdown, but your Medicare and your Social Security benefits are fully funded and they are protected. The only programs being debated right now are part of the under 65 healthcare system, not Medicare. So while you may see delays with paperwork or data updates, your benefits and payments are safe. And I'll see you in the next video. And as always, be well.